What causes a heart attack? A heart attack, or myocardial infarction, means that there is death of some of the heart muscle. This is caused by a blood clot blocking an artery and resulting in a lack of blood supply. As we get older, the smooth inner lining of the heart arteries becomes damaged and thickened due to the accumulation of fatty material called atheroma, made up predominantly of cholesterol. This process is known as atherosclerosis. Previously, it was thought that a progressive narrowing in the coronary artery caused heart attacks. It is now clear that this process can sometimes occur in coronary arteries that have minor narrowings when cracks or fissures develop in plaques. The exposed damaged inner lining of the coronary artery wall causes blood cells called platelets to stick to the damaged area and start the formation of blood clots within the artery. These blood clots prevent the flow of blood, vital for the heart muscle to survive. If the artery is blocked for more than a few minutes, the muscle cells beyond the blockage may become permanently damaged. It remains unknown why heart attacks happen when they do, sometimes affecting people who seem to have been perfectly well. Certain factors are known to increase the risk of having a heart attack. Smoking, family history of heart disease at a young age, high blood pressure, elevated cholesterol levels, lack of physical exercise, diabetes. The heart muscle that is injured by this blockage may become irritable and can cause irregularity in the heart rhythm. This can be fatal by causing a cardiac arrest, even when it appears that very little heart muscle has been damaged. This is why it is very important, if you think you are having a heart attack, you should call for an ambulance. The damaged heart muscle eventually heals with a scar, but may not be able to pump quite as much as it did before. In the majority of patients, however, there is enough good muscle left for the heart to function adequately, and for recovery to be complete.
Heart attack, or myocardial infarction, is caused due to coronary artery blockage. Coronary arteries are the blood vessels which supply the heart with oxygen and nutrition. Over time, the inside of these arteries develop fibrofatty plaques of different sizes. These plaques are made of cholesterol and other substances floating through the bloodstream, such as inflammatory cells, proteins, and calcium. Many of the plaque deposits are hard on the outside and soft on the inside. The hard surface can crack or tear, exposing the soft, fatty inside. When this happens, platelets come to the area, and blood clots form around the plaque. The artery narrows further, and in turn there is less room for blood to flow through the arteries. Finally, this results in the occlusion of the coronary arteries, resulting in the death of the surrounding heart muscles. The patient experiences tightness, heaviness, or constriction in the chest.
To me, you have been gracious, you have been faithful, meeting my needs. Lord, it's so plain to see, you have been good to me. I have been given so much I can't begin to thank you, and still I believe there is more. I believe there is more. I believe. So I open my hands to receive all that your love has in store. Lord, I believe.
ay isa sa mga taon na ang aming pamilya ay nakaranas ng matinding pagsubok. Noong July 23, 2012, akala ko po ay mawawala na ang aking dada dahil sa heart attack. Ngunit, mabuti po ang Diyos at siya ay nakaligtas. Sa kapangyarihan po ng Panginoon, ang lahat po ng aming kailangan ay natugunan. Ang dada ko po ay malakas na at hinaharap ang bagong yugto ng buhay. Ang aming pong pamilya ay tunay na mahal ni Jesus. Pinupuri po namin ang kabutihan niya. Madami po pagsubok, ngunit marami po ang katagumpayan sa piling ng ating Diyos. Maraming salamat po, Panginoon.
Lord, I believe.